Welcome to another episode of Painfully Fabulous. I'm Kristen.
And I'm Christine. We are CRPS warriors and here to remind you
When life is painful, you can still be fabulous.
Hey everybody, welcome to another episode of Painfully Fabulous. Today me and Christine wanted to talk about life with CRPS or living with CRPS. We've already talked in a previous episode about living with chronic pain. That can be generalized to our back pain or our migraines or fibromyalgia, but CRPS is ranked the highest pain on the McGill Pain Index. It's a 42 out of 50. It's higher than childbirth, amputation of digit, non-terminal cancer, and everything else on the list. And we live with it. And we try to conquer it. And we try to help others conquer it. And it's hard. So I thought, we thought, let's get together and talk about how CRPS has affected our lives, what it's like every day living with it, from the little things from little things like taking showers to the big things like losing most of our friendships, because that happens.
Yeah, I just wanted to add in there because you did bring up the McGill, excuse me, the McGill Pain Index. There's so many people too that don't believe it. I know we had some people in the group that mentioned that, family members and that just laugh it off and say, oh, how do they know, childbirth is really painful. You can't tell me it's more than that. So understanding it is very difficult unless you live with it and have experienced it, but it truly is painful.
And on that note, then, you just allow me a moment of time because we're going to start getting technical here, ladies and gentlemen. I'm pulling information up on my laptop so we could talk as we are recording. Because, Christine, you bring up an excellent point. The McGill Pain Index, a lot of people, when they hear that, they're like, oh, yeah, patients can say whatever they want. Oh, you hurt, you hurt. The McGill Pain Index wasn't created by chronic pain patients. It was created at McGill University. So the McGill Pain Questionnaire was developed at McGill University in 1971 by Dr. Melzak. It has been used by healthcare professionals around the world since, and it helps gauge the levels of pain that you're in. It's a series of questions, patients answer it, and the answers help them not prioritize, but gauge the levels of pain. Another area of confusion with the McGill Pain Index is that CRPS does sit at 42 out of 50, not 46 out of 50, 42 out of 50. Accurate information is key. You want your family members not to laugh at you when you're saying that you're in the highest rated pain? Try to be accurate. Isn't that awful though when you try to explain to them, I live with this pain, and they're like, oh yeah, I got a migraine. I know exactly what that's like.
Yeah, it's difficult, and I think people have to realize too that the McGill Pain Index gives doctors a way to gauge things because every one of us experience pain differently, and I know that after having this for 21 years, my pain tolerance has increased so much. So for someone that has a broken foot, let's say, they can say I've got pain 8 out of 10, and I could say I have an 8 out of 10, but really it's like a 20 out of 10 because my pain tolerance is so much higher now. It's crazy how your pain tolerance can increase when you experience pain for this long.
And it's crazy how the perception of pain is truly what gauges that for a patient. Back to the thought then again of somebody breaking their foot, broken bone. My God, you see that must hurt. Ouch. Oh, like the visualization of it, the thought process of it, that must hurt so intensely. Yet a broken bone on the McGill Pain Index, where are we at here? A fractured bone, you're at like 16. Our pain is invisible. Our pain's invisible for the most part. So another reason maybe why people don't take us as seriously as maybe they should.
Right.
Well, geez, we can all day about this, eh?
Well, and I was going to say part of that is our fault. I know for sure it's my fault because I push through. I don't show the pain. When I'm out in public, I look fine. I come home and that's when, I don't look so fine, and I can go to my room and be private with it. I think learning over these years to show a bit of the pain, it's kind of being vulnerable to it, but showing that can help people understand, especially friends and family. We don't have to be so strong all the time.
Absolutely. Absolutely. I agree. I will say too, though, Christine, where you are 21 years into it, think about your first year of it.
Oh, yeah. No.
Did you
Yeah.
wear that pain on your face every day?
Oh, yes. Yes.
Exactly. So it took you time to build that strength, to put that armor on, as Carla would say, to
Yeah.
smile and act like you're okay. But then you're right, a medical provider or a stranger sees that and they're like, "Oh, you're fine.
Yeah.
You're
And
fine."
actually bringing that up is funny, because I think I actually felt that way after about 6-7 months of experience CRPS. That's sort of when I found that family members, friends, others that didn't understand it thought, well, you should be better by now. If you do this or you do that. And I started to feel like a burden on people, right? So I think that's sort of where I pulled back and didn't show it as much or hid it more, because I didn't want to be that burden on people. And then as the years went on, I hid it more and more, right? So I think that's where it happened for me.
Let's touch on that then a little bit, feeling like a burden on other people. That is, it's very common for CRPS warriors to feel like they are a burden on their loved ones. Um, that's a hard one to deal with. It's very difficult because you want to disassociate yourself from those people, maybe, or you want to hide who you are, maybe, instead of being authentic to who you are. Um, it's very challenging.
But it is difficult, and I think in hindsight, that's sort of where I found myself, hiding it more. At the time, I didn't realize it. I just did what I did because, I didn't want to be a burden. I didn't want people saying, oh, you should be better by now, or try this, or why don't you do that, because we, I was a guinea pig. I'm sure you were. I tried everything possible to get better, and nothing worked.
Don't say nothing. There are
Yeah.
so many people who feel once they're diagnosed, once the reality kind of sets in that this is my new life, they have to grieve, which
Right.
we need
Right.
to talk about in a whole episode as
Yeah.
well.
Yeah. Yeah.
Grieving your former self and allowing, being there for other people around you to grieve you as well.
Right. Yeah.
Yeah.
Yeah. And I feel now, in the present day, I have accepted my new self, um, and live doing what I can do. And there's days we push through, right? And like I think we're both sitting here right now with, I know I have a major migraine, and I'm sure, I think you mentioned you had one too. Um, and I think my migraine's been around for 2 weeks. Um, and you just do what you got to do, because either that or you just lay in bed and nothing. I don't want my life to be like that, right?
Okay, then you mentioned that. I think then it's a lot of psychological as well. Nobody wants to hear your pains in your brain, or right? We're not saying you're making it up. You're not making it up, but your brain is miswired at this point in time, right? It's signaling pain when it's not really there. Frig. It also affects your short-term memory. So I totally forget what I was just saying. Mid-sentence. You could just be talking and all of a sudden, CRPS affects almost every nervous system in a patient's body. So not only is it a pain condition, but like just a perfect example there, it affects your memory, it affects your communication skills, fight or flight mode, mental health. It can affect
Your
absolutely everything.
your body temperature.
Yes.
It does. It affects everything. And I think the hardest part for myself is doctors. Not all doctors believe that, and they will give you a hard time and say, "Oh, that's not from CRPS. That's," but your body, before and after CRPS. So just what I do is I've over the years written things down and sort of paid attention to when things happened and why, and it I believe it's all from CRPS. There's a lot of things that happen, just because of CRPS.
Absolutely. The fact that we have kind of the mindset, though, that we're not going to let this own us. We're not going to let this take away our sparkle, as I've been saying. I think that psychologically is greatly benefiting us, because there are some people, if you're watching right now and you are in bed suffering from CRPS because you can't get out, we understand what that's like too.
Oh yeah.
You're not alone, and there's nothing wrong with not being okay. Just don't stay there for too long. Know that you're not alone. Find people, find resources, find Conquer CRPS, and know that you're not alone. If you have to lay in bed nonstop, that's okay. I can't emphasize that enough. Every patient is different and every journey is different. It's just about feeling okay about not being okay, I guess.
Yes. And let me just go back here, because my entire first year was in bed. And for myself, I had to actually remove the TV from my room, because that made it so much easier for me to stay there. So if you're having difficulty pushing yourself, because it is painful, we know, we can relate. But if there's something there that's helping you stay there, try and remove it, because I at least had to get up to go to the living room to watch TV, or whatever hobby or whatever you enjoy. Forcing myself just to get up to that next room helped. It was a slow process.
That being said, then I will say then that Conquer CRPS, what you and I and Patty do with Conquer CRPS and what you and I do with Painfully Fabulous, finding a passion, finding a purpose or a project or whatever you can do, because you feel so helpless. Like there's nothing you can do while you're laying in bed, is the thought that we both had. We both had it. What am I going to do with my life? I'm stuck in bed.
Why me? Why
exactly.
me?
But then you realize there is an opportunity somewhere, somehow, even just sharing your story, inspiring, connecting with others. The finding that oomph, I don't know. I would be lost without it. I wouldn't have gotten dressed or put on my makeup today if it wasn't for these projects that we do and these goals that we have of creating a change in the CRPS community. So I encourage anybody out there, craft, cook, or I don't know, find a good show, but in the living room.
Yes. Yeah. Yeah.
Find a project. What's another hobby somebody can do with CRPS and be okay with it?
Even something just like little as journaling, or
Yes.
like, just don't think big, little things, but leave your journal in the next room, or find a nice little cozy nook in your house that you can leave your stuff there. And then, you know what? Okay, for 15 minutes today, I'm going to leave my bed. I'm going to go do that.
If possible.
Right, if possible. But like I said, if it's not possible for 15 minutes, do it for 5. Because there are times, most people, I know some can't, but you have to get up to go to the washroom. So extend that a little bit, just little steps at a time. And for myself, my own story, getting myself out of the bed helped. It made me feel better, because yes, I was in pain, but you know what? I was dressed today. That was a huge step.
I only get dressed on days that I have to do this stuff because it takes so much energy. It takes so much work to try to look like a human.
Okay,
my jaw hurts.
Yes. Now tell me though, you are proud of yourself for being able to do it for these days.
Oh, I look good.
See? Yes. And no, it's true though. On those days, you look good. When you look good,
It
even a little
feels
bit of
good.
makeup, yes, feels good,
Yeah.
right? So even if you can only do it 1 day a week, give yourself that opportunity to feel good.
Yeah, absolutely. When I was younger, I had depression, and my mom used to say to me, "Now, when you're having a sad day, you put on your mascara because you don't want your mascara to run."
Oh,
So, if
yeah,
you're in bed and you can't get out, if you're a woman, or if you're a boy and you want to play around, that's fine.
yeah.
Grab yourself some mascara, put your mascara on, and
Do your
just
nails.
yeah, and just lay there. If you're in bed and you're stuck in bed, don't we get it? We totally understand, but just something for you because you matter. That's a very important lesson that I'm still working on learning is that yes, I have CRPS. No, I can't work. I can't work a job. I can't pay the bills. I can't do this. I can't do that. I can't do so many things, but I can still show up every day and try my very best. My
Yes.
brain fog is awful today.
You know what? I wouldn't even know it.
That's good.
Yes.
That's good. And don't doubt yourself either. That's another good one. Don't question yourself. Just work with what you got because what you got
Oh,
is fabulous. It's
sorry.
painfully fabulous.
I know I'm trying to move here and I'm a little sore today. That's why I look this way and I have anyway. Um yes, and that's another thing. I'm always like, oh gosh, I look a mess, but you know what? It doesn't matter. It doesn't matter what you look like. Really, you know, I shouldn't say this, but it doesn't matter what you feel like. It matters how you deal with it and how you know, push through it because if I really sat here every day and went, oh, I'm in so much pain. I do this because my family's going to say you do that. um I'm in so much pain, but I get up and I move. I do go do little things. You know what? There's days that I'm in pain, but I have to go. I don't go to the grocery store. I pick up the groceries because I order them online, right? I find different ways to do it. But getting out into the car, yes, it's painful. But sitting there sometimes in the sunshine, it just feels good. Okay, I did it. I did
That
something.
I'm so glad that you said that. Okay, so again, every patient is very different, guys. As you're realizing here, me and Christine, over the years of talking, we've realized even our ways of living are so different. The for me, the thought of actually getting up, walking down the stairs, getting my shoes on, putting my jacket on, getting into the car, and everything, that would take all of my energy for the entire afternoon. But sitting in that sunshine feels so freaking good. I really do. I'm like my cat. On those high pain days when I can't get out of my house and push myself to get in the car and go for that drive, I will. I'll open up the window and I'll just feel the sun on my face.
It makes a
Just
difference.
adapt and improvise and overcome so you can conquer. Whatever you got to do, just if you're in bed, wiggle your toes. There's your movement. Um,
Mm,
Living with CRPS can be incredibly challenging and going to touch on an uncomfortable topic for a moment. It is sadly nicknamed the suicide disease by medical professionals for the past, I don't know, however many years. With Conquer CRPS and Painfully Fabulous, we really want to change that. We don't want the next generation of CRPS warriors to hear their diagnosis, to not be given any resources, and to find out on Google that they have the suicide disease. That's not okay with us. So we push ourselves out of bed every day. We grab our laptops and our phones and we do whatever we can within our network to try to create a change. If if you're struggling, you're not alone.
mm-mm.
If you don't think that it's going to get better, you're wrong. It's going to get better. It's going to get a little easier. Christine, God love her, 21 years in,
Mhm.
ladies and gentlemen. She was bedridden for the first year. She has gone through so much. And look at her. She's sitting up. Ladies and
Yeah.
gentlemen, I'm sorry, but believe in yourselves a little bit. Believe in yourselves. And if your relationships and your family members and those around you don't understand, maybe stop inviting you out to social occasions. Maybe stop calling you or checking in. No,
Or
that's part of the process too. Go
yes,
ahead.
or I was going to say, or telling you how to get better. That's a huge thing.
That I will say, I would love for somebody to offer me advice. Even if it's wrong, I'd love for somebody to care enough to want to suggest something. So when your friends and family members and strangers recommend that you take 7 Tylenol and dance on your left foot and twirl around 3 times underneath the moon, you're going to cure absolutely every disease possible, or whatever trick or tip that helped them or their friend or their loved one, it might not work for you. And you got to be okay with that. Just humor them, I guess, or be patient with them, I guess, when they suggest those things, because I know it can be frustrating. But
Especially when you're in pain.
Yeah. And then
And
their migraine.
and so you do have to decipher too, because so some people can mean it out of caring and stuff like that. Others can do it because they're tired of listening to you. So, it all depends on your situation. And just know that you're not alone. You know, as much as that's frustrating and hurtful and everything, reach out to us. We've got groups, we've got, the Facebook group, we're on Instagram, everything. Because people that have it understand. And just, getting that little bit of support with people that understand and know what you're going through helps so much.
It has been really incredible to connect with the people that we have over the past few years. Every time we get somebody new who joins us, they say, "Can I ask a weird question?" And then they just ask something that's related to CRPS, and every person in the group is sharing their stories, and all of a sudden the person's like, they just feel like they've been seen and they've been heard, and they're not crazy, because
Right.
you're not. I mean, we are kind of crazy. It makes us kind of crazy, but like, try to have fun with it.
Yeah. Yeah. It does make a world of difference because, as everyone knows, it's a struggle to get up and get ready. I mean, I've had to, I'll be completely honest. I go to the hairdresser like once a week to have my hair done because I can't do it anymore. And showering for me is very difficult, because I have it I have it in both feet, both hands, my left leg, but my left leg is so bad that I cannot have the water hit it because it's so painful. And I know other people experience that. And people don't realize that, oh, the wind can be painful. How can the wind be painful? Like, little things like that's the extreme of our pain. So having to accommodate, for showering, I can't shower daily like most people. And it's not easy to shower with one foot out of the water. So these are things that people don't see that we experience daily. And
Right.
there's so many more things that CRPS patients deal with that people don't see. And when you're finally get enough energy out to do something, that's when you hear, "Oh, you look so fabulous." You don't look sick. Like, and it's hard to sit there and say, someone will say to you, "Oh, how are you?" It's hard to say, "Oh, I feel like shit." It's always, "Oh, I'm good. I'm fine. How are you?" So they
But that
don't
gets
get it.
tiring too,
Pardon?
right? That gets tiring too, right?
Yes.
Oh, I'm good. I'm so great. Thank you.
Yes. One of these days, I really just want to come out and say, honestly, I feel like shit. I'm in so much pain. You just don't know.
Right.
But
I want to cut my leg off, ladies and gentlemen. Beep.
oh, we gotta bleep that. But
But
it's true.
yep. I remember when I used to have to walk to work. So before CRPS, I was a barefooter. I would hula hoop down the street as I was walking with my bare feet. I would even sing like nobody's business. I didn't care. I had fun with life. But then people started seeing me after my CRPS with my arm, and my arm would just hang there, right? And then they'd ask me what was wrong, and I'd tell them. And then eventually my legs started going on me. So my legs started dragging behind me with my arm hanging, and people were like, well, what's wrong with you? Eventually I just said, don't worry, it's still attached. So living with CRPS is extremely, extremely difficult. It's challenging. It affects every nervous system in our body, like we mentioned, and it truly affects every aspect of our lives. We could talk about this for days and still forget something, right?
I think we've missed so much. Like, the weather, how the weather affects us.
Everything.
Yeah, there's so much. We could go on and on and on.
Well,
So
we will.
and you know what? Anybody that's listening, please, in the comments below, just let us know, what you're struggling with. Maybe we can address some of that.
Yeah. We do have pamphlets. We have educational pamphlets for you, for your loved ones, for your medical providers, whatever you need, email us. You're not alone. Me and Christine here on Painfully Fabulous, we are going to try to talk about a few more things that are related specifically to CRPS, because although we have other chronic pain conditions, CRPS, she takes the hat, I think is the way, or puts the icing on the cake or whatever. It's a bitch.
It
is. Absolutely. So lots of facts that we do have to share. Go to www.conquercrps.com to learn more about CRPS. We're going to do more videos here, of course, little micro lessons and stuff. We're going to try to chat a little bit more too. So thanks for watching. Please like, share, subscribe, and hit that notification bell to be notified for upcoming videos, and
stay painfully fabulous.
Bing.